It was a time when change was much needed, and in many sectors, change was made. The health sector was on the list, whose fate was the betterment of services to the citizens, who at the time faced numerous challenges. Devolution of Health saw responsibilities divided between national and county governments, whereby health policies, technical assistance, and management of national health facilities would be overseen by the national government. County governments, on the other hand, would coordinate delivery of essential health services.
The worst mistake that we did was to give health to the counties.
There was no proper mentorship from the Ministry of Health on how to properly deliver these services.
10 years down the line, satisfaction is not fit for the execution of the changes made in the health sector. This is made clear by the Kenya Medical Association president, who depicts that changes were mindful but drastic.
The issue of now implementing and delivering of those services is what needed to be looked at more critically. Because having the service at the county level is a good thing, but not being able to properly manage issues of the infrastructure that you need to provide that services, issues of the human resource that you need to better provide the service, and the management of that service at that level has actually reversed that particular gain, where the services were brought closer to Mwananchi.
According to Section 1A of Article 43 of the new Constitution, Kenyans are entitled to the highest attainable standards of health, which includes the right to healthcare services, including reproductive health care. Section 2 of the same article provides that a person shall not be denied emergency medical treatment. This, however, has been recently countered.
If I am suffering because the government, I cannot afford my medication, am I a happy Kenya? Am I enjoying the healthcare the government is giving? No, I'm not. And it is happening to so many Kenyans, because healthcare is not about equipment only. Okay? It's about the health of the population.
Dr. Were Onyino goes ahead to outline the hardships encountered by citizens in the changes brought about by the Constitution. This, he said, as he advocated for further training of health workers in various specialities, such as surgeons.
Now that haphazard implementation has led to, we have facilities in our counties, but when you go to those facilities, yes, there's a building, but you go there, there's no doctor to attend to you, or if there's a doctor, then he's overwhelmed with the numbers that are coming in.
There are those challenges. It was a good from a point that common Mwananchi will access those facilities closer to their places, but then it is a challenge to us as healthcare providers because those institutions haven't been equipped.
This is being further vouched for by Kenya National Union of Nurses Nairobi chairperson Boaz Onchari, who gives a thumbs up to the Constitution, but questions the governors managing the health sector in various counties.
You see, as the drafters of the Constitution, what they had in mind was perfect, but the execution and how it is done is actually what is bringing up these issues. So other than the aspect of human resource being decentralized to the counties, then there isn't any other issue we can say that is a problem. Because we could want to see those hospitals improved by the county governments. But then if the national government's control scene that is now able to bring in the required human resource.
The 2010 Constitution came with its fixes and unexpected distractions. However, a number of solutions have been suggested to avoid future predicaments. This includes formation of a healthcare service commission, as well as the national government taking over improvement of human resource services.
From an angle that we're pushing for a health service commission, that means human resource and payment of salaries will be controlled by the national government. Because you realize much of what we are seeing in terms of go-slows and strikes is because, number one, the counties are not able to pay in time. They take long to pay. At times they say some of the allowances that actually the health providers are being awarded to, then a county says that we are not in a position to give. So if all that issue of money aspect in terms of salaries is left at the national government, then the county governments concentrates now on improving the structures, improving the supplies of equipment, even drugs. Then I think it will be easier even for the national government to manage and put the county government to task that since we've done our part, then they also need to do their part.
Ben Kerera, K24, Evening Edition.